America, once a beacon of hope and prosperity, faces deep challenges. Our nation, known for its resilience and innovation, is now grappling with unprecedented issues that test our unity and resolve. Our nation is at a crossroads. The decisions we make today will shape the future for generations to come. Systemic issues threaten the fabric of our society. From economic disparities to social injustices, these problems are deeply rooted and complex. We must confront these problems head-on. It requires collective effort and unwavering determination. The American dream, once a promise of upward mobility, now feels out of reach for many. The gap between the rich and the poor continues to widen. Stagnant wages, rising costs of living, and a fraying social safety net contribute to this crisis. Many families are struggling to make ends meet. Millions of Americans struggle daily. The sight of long lines at food banks and people sleeping on the streets is a stark reminder of our challenges. The statistics paint a stark picture. Numbers alone cannot capture the human suffering behind them. We must acknowledge the severity of these issues. Only by facing the truth can we begin to find solutions. Ignoring them will only worsen the situation. Our infrastructure is crumbling and our communities are suffering. We need open and honest dialogue to find solutions. It's through conversation and collaboration that we can hope to build a better future. Healthcare costs continue to skyrocket, putting immense pressure on families and individuals across the nation, leaving many Americans uninsured or underinsured. This lack of coverage forces people to make difficult choices between their health and other essential needs. This creates a two-tiered system where access to quality healthcare depends on wealth. Those with financial means can afford top-notch care, while others are left to navigate an overburdened public system. Millions face financial hardship due to medical bills. Families are often forced to deplete their savings or go into debt to cover healthcare costs. The Affordable Care Act, or ACA, brought some improvements, expanding coverage to millions. However, challenges remain. Many still find it difficult to afford premiums and out-of-pocket expenses. Premiums and deductibles are often unaffordable, making it hard for people to access the care they need without financial strain. Many struggle to find in-network providers, leading to delays in receiving necessary treatments and higher out-of-pocket costs. The COVID-19 pandemic exposed and exacerbated these weaknesses, overwhelming hospitals and healthcare workers. The pandemic highlighted the need for a more robust and equitable healthcare system. It showed us that our current system is not equipped to handle such crises effectively. We need solutions that prioritize access and affordability for all Americans. Only then can we ensure that everyone receives the care they deserve, regardless of their financial situation. The unemployment rate, while currently low, masks deeper economic anxieties. Many Americans work multiple jobs to make ends meet. Manufacturing job losses, driven by globalization and automation, have devastated communities. The decline of unions has eroded worker bargaining power, leading to wage stagnation. The gap between the rich and the poor continues to widen. This trend threatens social cohesion and fuels resentment. We need policies that promote job creation and skills development. Investing in infrastructure, education, and clean energy can create good-paying jobs. We must ensure that economic growth benefits all Americans. Millions of Americans struggle with poverty and food insecurity. This issue affects people of all ages, backgrounds, and regions, creating a widespread crisis that demands urgent attention. They rely on government assistance programs like SNAP or food stamps to survive. These programs provide a lifeline, but they are often not enough to cover all basic needs. Children are particularly vulnerable, with long-term consequences for their health and well-being. Malnutrition and stress can hinder their development and academic performance. The rising cost of housing, healthcare, and childcare pushes many families into poverty. These expenses consume a significant portion of their income, leaving little for other essentials. Systemic racism and discrimination worsen outcomes for marginalized communities. These groups face additional barriers that limit their access to resources and opportunities. We need a comprehensive approach to address these complex challenges. This includes policy changes, community support, and individual action to create lasting solutions. This requires investing in affordable housing, ensuring that everyone has a safe and stable place to live. Expanding access to quality education and job training is crucial. These opportunities empower individuals to secure better jobs and improve their economic standing. Strengthening the social safety net is also essential. This includes providing adequate support for those in need, ensuring they can meet their basic needs and work towards a better future. We must break the cycle of poverty and create opportunities for all Americans to thrive. Together we can build a more equitable and just society where everyone has the chance to succeed.